Have you ever thought about a common sore throat in a kid? Well, imagine that same sore throat snowballing into a lifelong heart condition. It sounds crazy, right? Today, we're going to trace the surprising and, honestly, pretty dangerous path of rheumatic fever.
So that's the big question, isn't it? It just doesn't seem possible. How on earth does a run-of-the-mill childhood sickness escalate into something that can permanently damage one of our most vital organs? Well, let's unravel this medical mystery together. Okay, let's get right into the definition. Rheumatic fever isn't really an infection itself. It's more like a dangerous overreaction by the body's own immune system. So what happens is, a few weeks after an untreated strep throat, the immune system just goes haywire. It launches this huge inflammatory attack, not just on the leftover bacteria, but on the body itself. And it zeroes in on the heart, the joints, the brain, and even the skin.
So where does it all begin? Well, it all starts with a very, very familiar foe, one that sets the stage for a much more complicated and serious battle inside the body.
The trigger, the initial culprit, is group A Streptococcus. Yep, that's the bacteria behind super common things like strep throat and tonsillitis. And while pretty much anyone can get strep, this dangerous secondary reaction, rheumatic fever, is really picky. It almost exclusively targets school-age children, usually between 5 and 15 years old. That is the really vulnerable window. So the big question is, how does a simple infection trick the body into a full-blown autoimmune crisis? Well, this is where the body's own defense system gets dangerously confused.
It's really a four-step chain reaction. First, you get the strep infection. Simple enough. Second, your immune system does its job and makes antibodies to fight it. But then, step 3, here's the critical error. For some reason, those antibodies also recognize parts of our own heart, joints, and brain as the enemy. And that leads to step 4, a widespread, damaging inflammation.
You know, this whole process has a really cool scientific name, molecular mimicry. And that's exactly what it is. Think of it like a case of mistaken identity on a microscopic level. The strep bacteria are wearing a disguise, so to speak. They're covered in proteins that look almost identical to our own human tissues. So the body's antibodies, which are out hunting for the bacteria, get confused and start attacking our own cells by mistake. It's friendly fire. So with all this chaos happening inside the body, how did doctors figure it out? Well, they basically become medical detectives, and they use a very specific set of guidelines called the Jones criteria to piece together all the clues. And the formula they use is super precise. To make a diagnosis, a doctor needs to find either 2 of what they call major clues, or 1 major clue plus 2 minor ones. But here's the most important part, the absolute deal breaker. They have to have definitive proof that a strep infection is what kicked this whole thing off. Now, to remember those really important major clues, there's a fantastic mnemonic that every medical student learns. Jones. And you'll often see the O written as a little heart, just to really hammer home the cardiac risk. So let's break down what Jones stands for. First up, J is for joints. And we're not talking about a little ache here. This is a full-blown migratory polyarthritis. In fact, it's the single most common sign. The pain and swelling are severe, and they literally jump from one large joint to another. One day it's a knee, the next it's an ankle. It can be so agonizing that a child might just completely refuse to walk. The O, shaped like a heart, stands for carditis. And let me tell you, this is by far the most serious complication. This is the one everyone worries about. The inflammation can attack all 3 layers of the heart. So doctors are listening for a racing heart, any new murmurs, or complaints of chest pain. This is the part of the disease that can cause permanent scarring on the heart valves and lead to lifelong rheumatic heart disease. Next, N is for nodules. These are these little firm lumps that pop up under the skin. And what's weird is they're completely painless. You'll usually find them over bony parts of the body, like the elbows, knees, or even the spine. They aren't harmful by themselves, but finding them is a huge clue that points right to rheumatic fever. E stands for a mouthful, erythema marginatum. This is a very unique, non-itchy rash. It looks like these strange pink rings with clear centers, and you'll usually see it on the trunk or the limbs. Now, it's actually pretty rare to see, but when it does show up, oh man, it's a classic textbook sign of the disease. And finally, S is for Sydenham chorea. Historically, this was known as St. Vitus's dance. It's a neurological sign, and it causes these involuntary, jerky, almost dance-like movements. It can also mess with someone's speech and cause some emotional instability. But here's the tricky part. It's often a late bloomer, sometimes not showing up for months after the initial infection.
Okay, so those major clues from Jones are huge, but they don't tell the whole story. To really lock in the diagnosis, doctors have to back them up with those minor criteria we mentioned, and, most importantly, with cold, hard evidence from the lab.
And here are the other key pieces of that diagnostic puzzle. On one side, you have the minor criteria, things like a fever, or just general joint pain, nothing as specific as the migratory kind. But the lab evidence, that's non-negotiable. Tests like an elevated ASO titer or anti-DNA SPE are absolutely crucial. They're basically looking for a sky-high level of antibodies against the strep bacteria. And they serve as the smoking gun that links all these crazy symptoms back to that one initial infection.
So once the diagnosis is confirmed, it's time to act, and act fast with a multi-pronged attack. So the big question then becomes, how in the world do you fight a disease that's caused by the body fighting itself?
The treatment is really built on 4 main pillars. First, you hit them with antibiotics, like penicillin, to wipe out any strep bacteria that might still be hanging around. Second, you bring in the anti-inflammatories. You'll use something like aspirin to calm down that awful joint pain, but you save the big guns, the powerful steroids, for when the heart is inflamed. Third is just good old supportive care. Strict bed rest is so important, especially with carditis. And finally, you provide nutritional and emotional support to help the kid get through this whole ordeal. But listen, treating that first attack is really only half the battle. Because once a person has had rheumatic fever, they are at a much, much higher risk of getting it again with any future strep infection. So the focus has to shift to long-term prevention. This is what doctors call secondary prevention, and it requires a serious long-term commitment. We're talking about regular doses of penicillin, sometimes for years and years, just to prevent another strep infection from ever taking hold. And how long you have to do this really depends on how bad that first attack was. If there was no heart damage, maybe it's for 5 years. But if the heart valves were damaged, we could be talking about lifelong prevention. All right, so after seeing this whole chain of events, this entire domino effect, from a simple bacteria to a confused immune system to a potentially damaged heart, what is the one single thing, the most effective action, that could stop this whole cascade before it even begins? It's that simple. Treat the sore throat. Promptly treating a strep throat with the right antibiotics gets rid of the very bacteria that triggers the entire autoimmune catastrophe. It's just a powerful reminder that sometimes the best prevention for a complex, scary, life-altering disease begins with something simple, something early, and something absolutely crucial.